For me, what I think is going to be the greatest opportunity for the Faculty of Nursing and Midwifery is that we've often been challenged by being able to provide the opportunity for the development of actual clinical skills. And whereas a lot of the programs that we develop, there's a lot of theoretical content in them, and we obviously work with our clinical partners, and that's where a lot of the clinical exposure takes place. But in terms of certain programs we have, for as an example, wound management and tissue viability, we're challenged to be able to provide specific skills, for example in the area of compression therapy or in the area of Doppler as an example. And I see a synergistic relationship will have been developed in terms of in 5 years' time between the school and the faculty, where the faculty will be able to offer bespoke clinical skills to enhance the theoretical modules that we're delivering within the school. And I think in that way, what the faculty will be focusing on is very much on a service need, and it'll be very much a service-driven type of model, whereby they'll be saying what exactly is required, what are the demographics of the population, how are they changing, and what skills do people require day to day within their clinical practice. And whereas we in the school will be able to offer a lot of theoretical exposure, looking at sort of like the models behind what exactly it is we're doing, the faculty will be able to then look at what clinical skills then could enhance that theoretical knowledge, because sometimes we're kind of caught up in terms of a modular-based system where we have a specific number of hours, and that doesn't always lend itself to focusing very particularly on a clinical skill. And that for me is where I would see that when we review back over the Faculty of Nursing and Midwifery's performance over the 5 years, we'll definitely see a huge intertwining between the clinical skill development and the clinical practice arena. And that I see will be a major advantage for the health service in Ireland and indeed for the nursing and midwifery population.
As Executive Director of the Faculty, the achievements I would expect will be benchmarked against our current strategic plan, our 5-year plan 2014-2019. And essentially I would anticipate that at that time we would have continued to work to our mission and vision of the faculty and be strategically achieving our main aims and our strategic objectives. I hope that the faculty will have developed as a fit for purpose and a lean organisation. I think in terms of the key areas of development and linking to some of the issues that Zena was referring to, I think first and foremost I would like to see the faculty having developed itself as a forerunner in terms of the provision of continuous professional development, continuous education activity, and indeed the maintenance of professional competence training and learning. I think fundamental to that, I think we would have won the competition that the Nursing and Midwifery Board of Ireland would have tendered for in relation to the management of the professional competence schemes linked to the legislation. So essentially we will be working in collaboration with our colleagues in the School of Nursing and Midwifery, working with our colleagues in the Institute of Pharmacy and working with our colleagues in surgery to provide not only nursing and midwifery continuous professional development activity, but interdisciplinary continuous professional development activity for the benefits of registrants, but also for the benefits of service improvement and patient outcome. I think building on that, I hope the faculty will have developed its consultancy expertise in this area to provide consultancy not just to other healthcare professions in Ireland, but other professions in Ireland and internationally in terms of how we go about structuring effective continuous professional development and how we go about developing and maintaining the professional competence of graduates both within Europe and internationally. I think going beyond that, I think again linking with our colleagues in the School of Nursing and Midwifery and indeed with our colleagues in the Health Professionals Education Centre, we would be instrumental in developing a research base in this important area of professional education. So it is important while we have continuous professional development to ensure that it is enshrined in some form of evidence, that it actually does what it's meant to do. I think building on that again, the structures that we have within the existing faculty, such as the fellowships, would continue to strengthen and it would become a must-have qualification for nurses and midwives in this country. And while we will expand on the current pathways to develop a fellowship and become a fellow of the faculty, we will be also looking at exploring new opportunities for new pathways into the fellowship as well. And finally, I think in that 5-year review, I would like to see our conference, which is the longest established conference, the longest established international conference in nursing and midwifery. I would like to see it to have evolved and developed so that it becomes a must-attend conference for all nurses and midwives, nationally and indeed internationally, exploring areas of research that examine the fundamentals of patient care that mean most to nurses and midwives in practice.